the name of a group of fat-soluble retinoids, including retinol, retinal, and retinyl esters. Vitamin A is involved in immune function, vision, reproduction, and cellular communication. Vitamin A is critical for vision as an essential component of rhodopsin, a protein that absorbs light in the retinal receptors, and because it supports the normal differentiation and functioning of conjunctival membranes and cornea, vitamin A also supports cell growth and differentiation, playing a critical role in the normal formation and maintenance of the heart, lungs, kidneys, and other organs. Retinal is responsible for production of an acid that affects gene transcription by means of cellular differentiation. Psychological roles of cells are specialized. Vitamin A also includes carotenoids, which are produced by plants. These are transformed to retinal. Fruits and vegetables, for example, contain beta-carotene, which is converted to vitamin A in the human body. The function of vitamin A. Vitamin A is necessary for bone, skin, and vision development. It boosts the immune system's defenses, making it more resistant to infection and disease. It also controls development by controlling the growth hormone, genes expression. An individual with a vitamin A deficiency can experience night blindness due to insufficient retinol supply, dry skin, poor growth, and developmental difficulties.
Vitamin A deficiency can result from inadequate intake, fat malabsorption, or liver disorders. Deficiency impairs immunity and hematopoiesis and causes rashes and typical ocular effects. Example is xerophthalmia or night blindness. Vitamin A deficiency is common in many developing countries, often because residents have limited access to foods containing preformed vitamin A from animal-based foods resources, and they do not commonly consume available foods containing beta-carotene due to poverty. According to the World Health Organization, 190 million preschool-aged children and 19.1 million pregnant women around the world have a serum retinol concentration below 0.70 micromoles per liter. Vitamin A intake is most strongly associated with health consequences during periods of high nutritional demands, such as during infancy, childhood, pregnancy, and lactations. Vitamin A deficiency typically begins during infants, when infants do not receive enough colostrum or breast milk. Chronic diarrhea leads to excessive loose vitamin A in young children. Vitamin A increases risk of diarrhea.
Good day everyone, so let's proceed to the sources of vitamin A. There are two types of vitamin A. Preformed vitamin A, also called retinol, is found in animal products. Good sources are fortified milk, egg, meat, cheese, liver, halibut fish oil, cream, and kidneys. The other one is provitamin A, is found in plant-based foods such as fruits and vegetable. According to the NLM, the most common type of provitamin A is beta-carotene, a carotenoid that produces dark pigments in plants' foods. Beta-carotene can be found in these brightly colored foods: cantaloupe, pink grapefruit, apricots, carrots, pumpkin, sweet potatoes, winter squash, dark green leafy vegetable, and broccoli.
Hi, I'm Ansley Aguilar and I'm here to discuss about the needed amount in diet for vitamin A. So, vitamin A is currently listed on the nutrition facts label measured in international units. However, the Institute of Medicine lists the recommended dietary allowance, or what we call RDA, of vitamin A in micrograms. of retinol activity equivalents to account for different absorption rates of preformed vitamin A and provitamin A carotenoids. Under the Food and Drug Administration's new food and dietary supplements labeling regulations, as of July 2018, large companies will no longer list vitamin A as IU but as micrograms of retinol activity equivalents, or in international unit, it is called mcg Ray. So, RDA, the recommended dietary allowance for adults 19 years and older is 900 micrograms of retinol activity equivalents for men. It is equivalent to 3,000 IU, and 700 mcg Ray for women. It is equivalent to 2,333 IU. So, the tolerable upper intake level is the maximum daily intake unlikely to cause harmful effects on health. The UL for vitamin A from retinol is 3,000 micrograms of form vitamin. So, the amount of vitamin A you need depends on your age and sex. Average daily recommended amounts are listed below in microgram mcg of retinol activity equivalent, or what we call RAE. So, life stage from birth to 6 months, recommended amount is 400 mcg RAE. Infants 7 to 12 months, 500 mcg RAE. And for children 1 to 3 years, the needed amount of vitamin A is 300 mcg RAE. The children from 4 to 8 years, the recommended amount is 400 mcg RAE. And from children 9 to 13 years, 600 mcg RAE. Teen boys 14 to 18 years, the recommended amount is 900 mcg RAE. And from teen girls from 14 to 18 years, the recommended amount of vitamin A is 700 mcg RAE. For adult men, the recommended amount of vitamin A is 900 mcg RAE. For adult women, the recommended amount of vitamin A is 700 mcg RAE. The pregnant teens, the recommended amount for vitamin A is 700 mcg RAE. And for pregnant women, the recommended amount of vitamin A is 770 mcg RAE. And for breastfeeding teens, the recommended amount for vitamin A is 1,300 mcg RAE.
Good day, STEM Aces. For today's episode, we are going to discuss about vitamin D. Did you know what is vitamin D? Vitamin D isn't just one thing. It's actually a collection of molecules, and vitamin D is also referred to as calciferol. It's a fat-soluble vitamin that is naturally present in few foods and added to others and available as a dietary supplement. It is also produced when ultraviolet rays from sunlight strike the skin and trigger vitamin D synthesis. Vitamin D made in our skin or absorbed from food is start off as inactive vitamin D. It then travels to the liver where it is packaged into the circulating form of vitamin D. This is what doctors measure when they order a vitamin D blood test. Finally, the circulating vitamin D is unpacked in the kidney to form active vitamin D, which is more than 100 times more potent than circulating vitamin D. The most well understood effect of vitamin D is on the bones. It helps absorb minerals such as calcium, phosphorus, and magnesium to help maintain strong bones. And also, vitamin D also helps the body break down and worn up bone and build new bone in its yolk. Vitamin D has other roles in the body, including reduction of inflammation as well as modulation of such processes as cell growth, neuromuscular and immune function, and glucose metabolism. Many genes encoding proteins that regulate cell proliferation, differentiation, and apoptosis are modulated in part by vitamin D.
Hello STEM Aces. I'm Diana Agustin from BSED2B Gensai, and for now we will talk about the deficiency of vitamin D. So what will happen in our body if we're lack on vitamin D? Well, vitamin D was originally discovered as a treatment for rickets. Rickets is a condition in children where bones are soft and weak. Children with rickets have deformed bones that can fracture easily. In adults, this condition of weak bones is called osteomalacia. Osteo means bone and malacia means soft. People with osteomalacia have very low vitamin D levels in the body, where the bones soften and become deformed. Vitamin D deficiency usually get if you do not get enough sunlight or suffering from milk allergies or following a strict vegetarian diet. Not everyone lacking in vitamin D will experience symptoms, but some people may have bone pain and muscle weakness. People who lack in vitamin D are also an increased risk of cardiovascular disease, cancer, cognitive impairment, and asthma. Vitamin D is also thought to play a role in the prevention of diabetes. These deficiencies can occur for a number of reasons. Just like I said before, people who follow strict vegetarian or vegan diets are increased risk, as most natural sources of vitamin come from animals such as fish oil, egg yolks, cheese, and beef liver. Also, if your exposure to sunlight is limited, you are also under increased risk of vitamin D deficiency. This is because your body converts sunlight into vitamin D. Another thing, if you have dark skin, you may also experience the deficiency because the pigment melanin reduces the skin's ability to make vitamin D in response to sun exposure. Studies show that older adults with dark skin increase risk of a vitamin D deficiency. As people age, their kidneys are less able to convert vitamin D into its active known as calcitriol. So again, this is Diana Agustin from BSED2B Gensai. So later on, Sir Ansley Paul Aguilar will explain how much vitamin D does your body need.
Hello STEMices, I'm Rochelle Alvarez, and now we are going to discuss the different sources of vitamin D. The major source of vitamin D is direct sunlight. When sunlight reaches us on Earth's surface, it contains two types of UV light, UVA and UVB. UVB interacts with the type of cholesterol found in our skin in order to make vitamin D. The point here is glasses only allow UVA to permit while blocking the UVB. So, getting that sunlight while meditating near on your window won't help you make vitamin D. Some foods do also contain vitamin D. The top three major sources of vitamin D when it comes to food are oily fish like salmon and tuna, beef liver, and egg yolks. Vitamin D dietary supplements are also available in the market. So next time you eat, make sure that you include egg yolks, beef liver, and oily fish. That's all. Thank you!
So, how much vitamin D you should take? The amount of sunlight needed ranges from about 5 to 20 minutes and 2 times per week. The darker the individual's skin color, the longer amount of time is needed. The use of sunscreen absorbs or blocks UV rays, which will affect the body's ability to produce vitamin D. Also, the recommended amount of vitamin D to be consumed daily is 600 IU or 15 micrograms. For instance, a cooked roll provides 539 IU and 1/2 cup of portobello mushrooms provides 192 IU for a total of 731 IU, meeting the daily recommendation. And also, toxicity threshold for vitamin D was ranged from 10,000 to 40,000 IU per day. Some says vitamin D recommended intake is at 400 to 800 IU per day or 10 to 20 micrograms. However, some studies suggest that a higher daily intake of 1,000 to 400 IU or 25 to 100 micrograms is needed to maintain optimal blood levels.